Now, 20 years ago, when we were training to do these big cancer surgeries, it was pretty much standard of care to make a big incision in the abdomen and get to the colon through a standard incision. And yet now we've advanced with surgical techniques, with laparoscopic surgery, keyhole surgery, and even robotic surgery, these minimally invasive techniques where the patient can have fairly radical cancer surgery to remove tumors, not just GI tumors, but other tumors, and yet not have a surgical scar, a big surgical scar anyway. And yet the surgery on the inside is the same, and the emotional burden on the patient, just because they don't have a huge scar, doesn't mean they've not been through a major operation, correct?
Absolutely. So, like you mentioned, 20 years ago, a patient they used to call it the zipline incision, which is, all the way up and down. It's not the case anymore. In some cases, we do have to make a bigger incision to be able to perform the surgery safely. But the minimally invasive approach, whether it's robotic, laparoscopic, or keyhole, all the benefits of it is, first, the oncologic outcome, which is the most important thing, is the same. So there's no.
So by that you mean survival.
Exactly. So early on, there were some questions about minimally invasive surgery being not as good from the cancer survival standpoint. But big data studies came out, showed that it's as good as the open surgery. And the other things that the minimally invasive surgery offers were, first, is less scar. That tends to be not a major concern, but some concern from the patients. But the most important thing is faster recovery, less pain, and quickly going back to family and work.
Right.
And potentially, if a patient's going to need more treatment like chemotherapy, being able to start that treatment faster.
Patients often say to me, what's better, doc? Should I have open surgery? Is robotic surgery better than open? But I try and emphasize to patients, the robot, the keyhole, the laparoscopic instruments that we use, it's not a robot per se that does the cutting. It's a human being driving the robot. So it's so important, I think, to communicate to patients that it's not about the technology, it's about who's using the technology. And you brought up a good point earlier, Jody, that your daughter asked about the surgeon's background. For surgeons who are performing cancer surgeries, obviously, like anything in life, the more you do, the better you get. How important is surgical experience? And do you find that robotic surgery is one of these surgeries where
I think
experience is so important? Yeah?
Robotic surgery is a newer technique, or it's pretty much the latest technique that we have available. I always explain to patients it's not artificial intelligence, like you mentioned. It's actually not a robot going in and doing the surgery and leaving like we see in the movies. But it's actually myself performing the surgery. But rather than touching the tissue with my hands, I'll be touching it with an instrument, whether it's with a laparoscope and robotic. I always think about it, and I always tell my patients, I will do the right operation for you. If we can do it through smaller scars and minimal pain, we will do that. But if I cannot do it, then we will do the appropriate surgery, whether it's open or laparoscopic, to cure you of your cancer.
And when we consent patients for surgery and we write the name of the operation on the consent form, we know what we're planning to do, but plans don't always go as they should. So there's all these caveats. We'll do a robotic procedure, plus or minus open if we have to, plus or minus lymph node sampling if we have to. And that often is quite difficult for patients because they only know what we've done when we wake them up and the procedure's over.
Exactly.
Do you find that's a difficult issue to communicate?
It is somewhat difficult. I think a big part of it is the counseling of the patient before the surgery. And I think, being a surgeon of a patient is an ethical contract. You really have to discuss with them, this is not just a one-time visit. I don't want you to think that you're just seeing me now and next thing you'll be in the operating table and me cutting on you. I was done, they get my contact information, my office number, my email, and they can contact me because there's always, either the patient or a family member, they will have more questions.
And we'll come back to Jody's story in a moment, but I think for patients who are about to have an operation, I personally don't think that the best time to ask the questions is 3 minutes before you're going into the operating room when the surgeon is often being screamed at by the operating room team, come on, let's get this going, we're running late. Do you try and do most of the pre-surgical counseling, the description of the surgery, the pros and cons? Do you try and get that done before the patient comes to the operating room?
Usually when the decision is made to proceed with surgery, that's done at the visit, at the initial visit of the patient. If we're still needing more testing Then after we have the testing, I'll have the patient come back again for a second visit to go all over the surgery. And that's not just the surgical aspect. That's what they need to do preoperatively, because oftentimes you ask the patient to drink the bowel preparation to clean their colon. That includes what to expect. So I also have the patient that will be drinking liquid diets right after surgery, and will be advancing your diet as you can tolerate it. Because that's another big aspect, because the patient in the past, any colon surgery, the patient will stay for about 10 days on an average in a hospital. I think now, if you do the enhanced recovery with minimally invasive, I think the average is about 2 to 3 days. So we're talking 1/3 of what used to be in the past. And again, before the day of the surgery, 24 hours before, the patient will often get a call from my office. Are you doing okay? Do you have any further questions? Is there anything that you're not comfortable with? And if there's anything, then I will contact the patient and see.
It's a great idea, actually.